Now let's return to Rocky and look at his risk assessment. Recall the framework for risk assessment includes risk and protective factors. Each of these can be divided into 3 domains: demographic, person-related, and contextual factors. Next, we consider the limitations of our assessment, which will help us in gathering further information. And then we consider future risk scenarios. Lastly, we want to assess the risk level and the type of violence. So for Rocky's risk factors, his demographic risk factors are that he is a young male, has experienced trauma when repeatedly hit by his father when he was young. He also witnessed domestic violence and, importantly, has a recent history of impulsive or reactive violence where he was the initiator. There is also a family history of violence with his father's aggression. Person-related or clinical risk factors are his binge drinking, which reduces his self-control, and possibly major depression, which could contribute to his irritability. Also, we note Rocky's recurrent anger, his frustration with the dynamics at home, and we postulate that he is experiencing unresolved grief about his sister's disability. The development of suicidal thinking is likely an indicator of increasing despair and could be a harbinger of escalating violence if he feels he has nothing to lose. Looking at contextual or environmental risk factors, the ongoing conflict and invalidating interactions with his father are particularly salient. Additionally, his father's heavy drinking, the adverse change in family dynamics after his sister's injury, his limited support, and Rocky's recent withdrawal from college are all significant factors. Fortunately, Rocky also has many protective factors. His demographics indicate prior stable functioning as he enrolled in college, and he has maintained a connection with his family. Also, there's no indication of criminal history or violent attitudes, no use of weapons, and no pattern of antisocial behavior. Person-related or clinical protective factors are that he is seeking treatment, he expresses sadness with his behavior, he has no major psychiatric or physical illness, is intelligent, expresses a measure of insight, and he has no other substance use problems aside from the alcohol. Contextual or environmental protective factors are his connection to his mom and his sister, his recreational activities, stable housing, access to educational opportunities, and apparent lack of financial stress. The limitations of our risk assessment are that it's based on his self-report, and we don't have any collateral at this point. We also have little information about his personality, peer relationships, occupational functioning, or any prior problems. So future risk scenarios include escalation of the conflict with his father, increasing alcohol use, financial stress, other losses, like the loss of a supportive friendship, worsening of his sister's condition, or crises like being kicked out of the house. With these kinds of situations, we can predict that his violence risk will increase. We want to help to prevent them. His current violence risk level is moderate to high and fluctuates depending on the context. His pattern of violence is predominantly impulsive with an element of planning. There are many factors that indicate treatment can modify his risk.